What I hope you got a sense of in the video was just how inclusive Detroit-Wayne County is as an organization in terms of including the community and the consumers and the work that we do. And one of the things that's important for you to know is that is indeed a mandate. You know, person-centered planning, we'll go through some of the other key components that are critical to make this work, make it effective for those that we serve. But as I mentioned, Medicaid, as you know, Medicaid is a social policy and is highly regulated, and there are particular things that we're expected to do when we serve those who are entitled to Medicaid. So I had left you with this idea that each region has a PIHP, and the region that we serve is considered Detroit-Wayne County. And the provider of those services is Detroit-Wayne County Community Mental Health Agency. What would probably help you to better understand the mental health agency is the mental health agency is a unit within a department of county government. So we have Wayne County, the Charter County of Wayne, and Wayne County has several departments, one being the Department of Health and Human Services, and the mental health agency actually is within the Department of Human Services. Now, mental health, how mental health agencies actually work, or authorities in some communities, the oversight, the legislation that oversees the work is Public Act 258. So we have a board, we have an executive director, medical director, all those things that we are accountable to as a public mental health agency. The thing I wanted to point out to you is that we have a particular mandate in terms of a comprehensive array. What we provide is not kind of the same old, come in, get your 20 visits, talk therapy kind of thing, because the idea is that we're serving the most severe of those who have mental illness, developmental disabilities, co-occurring disorders, substance abuse disorders. And through that, we're expected to work in partnership with those who we serve. In our system, we call them consumers, and to inspire hope, to encourage them, to help them through what we would call their recovery process. Understanding that mental illness is a condition, it's not a state of being. So we work really hard with that. Now, my focus is children, so we'll be talking more about children. And the reality for children is that some of the things that we see with kids is episodic. And so just because you're a consumer of public mental health services as a child does not mean that you will be so as an adult. So we'll talk a little bit about what those kids look like. So this is how the system is actually organized at the state. So I had told you at the state of Michigan, the Department of Community Health is the part of state government that actually gets the funding and provides the funding to the actual communities. And how it works is that there are community mental health service programs, CMHSPs, I told you that, who gets the state general fund money. We have the prepaid inpatient health plans that get the Medicaid money. In some communities, the prepaid inpatient health plans actually subcontract with the mental health service program. In Wayne County, the Detroit-Wayne County CMH agency has two contracts with the state. They are prepaid inpatient health plan, a Medicaid contract, and a general fund contract. The state also funds what are called coordinating agencies. Those of you who are involved in substance abuse would know coordinating agencies. Those are the agencies that provide the oversight and management for substance abuse services in communities. In our community, it would be SIMCA in the downriver and out county areas, meaning outside of Detroit, or the Bureau of Substance Abuse, which some of us know as the Department of Health and Wellness Promotion, and some of us now know as the Institute of Population Health. So that's the city of Detroit. And then Medicaid health plans. What you need to understand, those of you who try to get mental health services for your clients and then you're completely frustrated because you're like, what the heck, how come I can't get the right services, is that our system is designed that the state has carved out the services for the most severe of the clients, right? So the Medicaid health plans are those that actually provide for the physical health of those who are on Medicaid, and the 20 visits. So for example, those of you here who have health care, you know, you have your regular 20 visits for substance abuse and mental health services, right? You're aware of that, you get that. It's really neat. Use it sometimes, trust me, it works. Not the substance abuse part. I am not a substance abuser. Anyway, so the Medicaid health plans for those who we would call in our language as mild to moderate, the worried whale, kind of mildly depressed, you know, they get their services here at the Medicaid health plans. Now, those who are considered the more severe SMI, severe mental illness, SED, serious emotionally disturbed, or developmental disability, get their services here. Now, the challenge in our system currently, particularly with the Affordable Care Act and the need to be more integrative in our work, is that regardless if your mental health services are here, your medical services are still here, right? So you may have a client who has a Medicaid health plan and you're trying to get those 20 visits. But if that child is more severe or expends their 20 visits, they get services here. So that's how the funding goes at the state. The coordinating agencies actually get block grant money. And I'm not going to go into the details of that. It's less restrictive funding that comes from the federal government, and the coordinating agencies get that money. This is how Wayne County is organized, though. So we have Wayne County Community Mental Health Agency, that's the CMHSP, the PIHPs. We actually contract with coordinating agencies too. This is where the Medicaid money in our community goes for those who have substance abuse disorders. So the coordinating agencies actually get Medicaid money from us and state block grant money from the state of Michigan, which allows them to serve more than just those who are Medicaid. Medicaid is very restrictive. You have to have Medicaid, that particular entitlement, to get access to those services. So most PIHPs or CMHSPs or service providers have multiple sources of funding so they could fill in those gaps, right? We also have what we call direct contracts, and a lot of our direct contracts will be with a direct provider to do a specific service. We have an access center, what I'll talk to you about later, but the bulk of our services take place in what we call our MCPNs, or Managers of Comprehensive Provider Networks. So most of the funding that we receive go to this MCPN, and this structure was a state mandate. And how it basically works is the Detroit-Wayne County Community Mental Health Agency pushes all this money out to these portions of the community, and these guys actually provide the services. So we don't provide services, we actually manage the contracts and the funding, provide oversight. So in my role, for example, at Detroit-Wayne County Community Mental Health Agency as a director, I provide oversight to how children's services are developed, how they are managed to ensure that we're on track with what the state expects of us in terms of mandates as well as our fund sources. So within our MCPN structure, we have 2 MCPNs who serve specifically those who have a serious mental illness, that's an adult designation, and SED, serious emotional disturbance, which is a child designation. And we have 3 MCPNs who serves those who have developmental disabilities: Consumer Link, Synergy Partners LLC, and Community Living Services. So when someone comes into our service delivery system, they're assigned to an MCPN and a provider. Throughout this, even within this system, there is something, and we'll talk about a little bit more, called choice. And I'm hoping that when you listen to the video, you heard the folks talk about this issue of choice and the fact that they get to choose, just like you have a choice. Say you go to your doctor and you're not pleased with the outcome, you get to choose to leave that doctor. Our consumers have that same type of choice, whether it's therapists or providers and whatnot. And what that means is that this particular network covers the entire county. Now, some of you may know, for example, if you know Community Living Services, you know they're headquartered not too far from here, out in Westland, and probably most of the folks they see are in that area. However, if somebody on the east side of the city wanted to come to CLS, they can come to CLS. That's absolutely their choice to do so. Do we have any questions so far? Now, the thing that you need to understand is this is how Wayne County is organized. When you go to Oakland County, or you go to Genesee County, or you go to Northern Lakes, they are not organized this way. This is completely unique to Wayne County. And part of it was mandate, and part of it is just the expansiveness of the county that we actually live in and the numbers that we serve. So who's eligible? We talked a lot about Medicaid. It's not just Medicaid eligibility. There's some other services that folks are eligible for. You heard mention of the HAB waiver, habilitation supports waiver, and there's an adult benefit waiver. There's some other small pockets of money, my child. But the bulk of our money is Medicaid. And so to get the maximize the services in our system, you really, we're looking at those who are Medicaid eligible. Now, see that it says eligible, meaning that you don't have to have Medicaid to walk through the door. All you have to do is be eligible. So we will help through the process of accessing Medicaid. And this is an important thing to keep in mind, because in some populations that we serve, for example, those coming out of prison, they don't have Medicaid. So it becomes important that as a system we work closely with our partners in the Department of Human Services so those folks can access Medicaid, and we have programs and partnerships to help with that. They have to be a Wayne County resident. How things are organized, remember I shared with you that MDCH actually funds PIHPs. Those PIHPs and CMHPs are regional. So, and it's capitation. Capitation meaning that Wayne County, Detroit-Wayne County CMH gets a bucket of money, so to speak, and that bucket is used to serve all the Medicaid eligible folks in Wayne County. So if a Wayne County resident actually requires services in Oakland County, we're still responsible because we're still getting money for that person. So it's really specific to county, and that sometimes causes some challenges, and systems are always designed in a particular way, and there's always barriers or challenges, but we always try to overcome them. Serious mental illness, again, I told you that's a designation for adults, and serious emotional disturbance is a designation for children. And this is language you'll hear in community mental health. You will not, as those of you who are educators know, that's not the language you use in juvenile justice and child welfare. You don't use this language. This is specific to mental health, but it's important that you understand it, particularly as you try to make a referral and have a better understanding of what we mean by SED. Because you may have a client that you think requires therapy or counseling, and they may not be eligible to our system simply because the level of severity is not there, and they need to access their 20 visits in the Medicaid health plan. Those with developmental disabilities, and that may be the range from cerebral palsy to autism spectrum disorder, developmental disabilities typically would be a medical diagnosis. Yes, ma'am, in the back. I'm going to get to that real soon. When we talk about, I'm going to talk to you about when we say consumers, SED, what exactly that we're talking about, because that's important for you to know.